If you start noticing any of these signs as a man, especially a man of 40 years old and above, and you're noticing any of these signs, or two or few of these signs, or all of them, please don't take it for granted. It can be that you're already having prostate enlargement, and the earlier you start the treatment, the better for you. So pay attention to these signs and know if you are having any of them or all of them. Number one, frequent urination. If you notice that you are urinating more often, especially at night, and you have checked yourself, it's not your blood sugar, but you notice that you are urinating quite often, please, it might be that your prostate is enlarging. Don't take it for granted. Number two, urgency, urinary urgency. That you always, sometimes you are, whenever you will be okay now, but immediately you start feeling pressed, you will run, and sometimes before you get there, you're already peeing on yourself. It is not ordinary. It is not ordinary. Urinary urgency is one of the signs that you notice if you have prostate enlargement. You understand? That one that you will be running every time. It will be as if you've been okay since, but immediately you start, you will run as if you've not. People will like, didn't you know you were pressed before? You know, something like that. So that's the kind of what I'm trying to explain to you. The next thing is weak urine stream. Usually when you are peeing, you know, it will just, you know, that kind of one. Then at a point in your life, you now notice that it's now no longer as strong as it used to be. It's now weak. It's now like just dropping. It can be that your prostate is enlarging already. No longer as strong. Now going just weakly. You know that what I mean? That is one of the signs you notice if you're having prostate enlargement. The next one is dribbling at the end of urination. You have finished urinating, but it's still dropping and dropping, still pouring for a long time. Don't take it for granted. It can be that your prostate is enlarging. That one that you are finished peeing, but you are staying there, still dropping, and you're like, this thing should finish now. It's not ordinary. Please go and get yourself checked fast as possible. The next one is difficulty starting urination. Sometimes you go to the bathroom to ease yourself. You are there. Start urinating and you are waiting. It's not ordinary. It can be that your prostate is already enlarging, and that is what is affecting the passage of your urine through your urethra. So don't take it for granted, okay? That difficulty in starting the urine. You want to urinate, but you are staying too long. The next one is pain or discomfort during urination. You are peeing, you are feeling pain. Sometimes some men will cry. I know that we have always associated this symptom or this symptom to gonorrhea and the rest of them. But it can also be as a sign of prostate enlargement. Don't take it for granted. All right. The next sign you might notice again is urinary retention. You are finished peeing, like you are done peeing, but you are still feeling that you are still pressed. You have you have peed though, but you are still feeling that your bladder is still not relaxing, still not calming down, still feeling distended. It's not ordinary, because your urine, because of the enlargement of that urine of your prostate, is now pressing on your urethra, that the urine that is supposed to be coming out, or even pressing on your bladder and giving it the shape that the urine that is in the bladder is not emptying properly, is not emptying completely. That's why you are still feeling pressed even when you are finished peeing. So if as a man you notice any of these signs, please don't take it for granted. Just stay awake and quickly go to the hospital for proper medical checkup, so that if it is infection or any other thing, it will be treated. Then if it is something relating to your prostate, quick treatment will be commenced immediately before it escalates to something that is not good. All right, I hope this is able to save men. You have been gaining a lot from this platform. Have you been nice enough to also tell your friends and neighbors and relatives about all these things you've been learning, or about this platform, so that they can come and learn as well? What they are going through, they might not tell you, but they might be suffering it inside. They don't know how to say it, but if they come here, they will get their relief. So be nice and let them know that there is a place they can come and learn free of charge. Thank you for watching. Foods that helps to relieve the symptoms of prostate enlargement or prostate cancer. In my previous video, I mentioned the various signs of prostate enlargement, the signs you notice if you are developing prostate enlargement. But in this one, I'll be telling you the foods that you will be eating. You will notice positive changes if you are having any form of prostate issues. Before I tell you, I'll quickly scan through the causes of prostate enlargement. Number one, hormonal changes. Yes, when men grow older, from 40 years and above, their hormonal changes set in because of the testosterone and the dihydrotestosterone. They are not balanced enough, and that dihydrotestosterone is always higher, and it causes enlargement of the prostate. You understand? The next one is, genetics. If it runs in the family, if it has anything to do with the family, it tends to extend to the rest of the family members. That's what the research have shown. Lifestyle and diet as well. If the person is not doing exercise very well, if the person is not eating healthy diet, the person is just eating anyhow, or the person is not losing weight or maintaining healthy weight, it also affects it. The next thing is underlying health issues. If the person is having high blood pressure or diabetes or any of the health issues, it tends to aggravate the prostate and make it start enlarging. Hormonal disorders, other hormonal disorders can also cause it. I mentioned something like that. So how to prevent it? Healthy diet, exercise, good lifestyle, and also healthy weight will also help. But now I want to go ahead to tell you the foods that you can be eating that will help you a whole lot to relieve the symptoms of prostate enlargement. Number one of this food is tomatoes. Tomatoes are rich in lycopene, which is an antioxidant that helps to prevent oxidative stress or even relieve oxidative stress and prevent any form of cancer. And if there's any cancer going on, it helps to destroy the cancer cells. That is the work that lycopene does. Another food again is watermelon. Watermelon is also rich in lycopene, the same antioxidant that does this work I just mentioned. Another food you can also be eating is pumpkin seeds. Pumpkin seeds are rich in zinc. Egusi is also rich in zinc. You can also be eating egusi. It does a whole lot in helping you relieve the symptoms of prostate enlargement. Zinc is a very important mineral that keeps the prostate healthy. Do you understand? So go ahead with this food. Then vegetables as well, like ugu, bitter leaf, spinach, cabbage, and the rest of them. Even broccoli, they do a lot in helping to relieve the symptoms of prostate enlargement. So eat this food. Garlic and onions, don't joke with them. They contain antioxidant, they contain anti-inflammatory, they even have antibiotic nature. So all these sulfur foods, don't joke with garlic and onions. Eat them as often as you can. Fresh garlic and fresh onions, or even using them to cook, you are good to go. But make sure once in a while you also eat the fresh one. They are very good for you. Tiger nuts, like nuts, or generally nuts are good for you. Peanuts are rich in zinc as well. That's groundnuts. So you can also be eating them in moderate quantity. Remember moderation when you are eating everything you are eating. All right, so it's good for you. So nuts like cashews, it's also good for you. Cashew nuts, they're also good for you. Don't joke with them as well. Fruits, all fruits, like all those fruits like that are rich in vitamin C, like oranges, pineapple, guava, they are so very good for you. Eat them as often as you can. You cannot eat all these things at once in a day, no, but as often, just grab them. The next food again that is good for you is okra. Okra, they are rich in fiber, they are rich in antioxidants, they are also rich in vitamins. So please make use of okra. Eat okra as often as you can. Forget about the myth about okra affecting men's fertility and the rest of them. Okra, there is no scientific base saying that okra affects man's fertility. All right. The next food you need to be eating is beans, especially black-eyed beans. They are rich in zinc. So please eat them as often as you can. They will help to improve your prostate health. All right. The next food is seafoods like oysters, crab, prawns. They're also rich in zinc. Eat them. All right. Liver, chicken liver or beef liver. They're also good for you. They're also rich in zinc. foods that are rich in lycopene as well. More food that are rich in lycopene. You have pawpaw, you have guava, you have that's red guava, the red one. You have red cabbage, you have carrots, red bell peppers. They are rich in lycopene, which is that antioxidant that prevents cancer and relieve the symptoms of prostate enlargement. So as often as you can, don't joke with them. All right, they will help you to relieve this symptom. As often as, just make sure you note down these foods, so once in a while, or as often, not even once in a while, because in your situation you need to make sure you eat them, these specific foods I've mentioned, and avoid any form of processed food. Eat healthy food like I've mentioned here. You will notice positive change. Even if your prostate is already enlarging, or you're having prostate cancer already, these foods will give you positive changes. You will get positive results if you eat these foods and do these things I mentioned. Okay, I hope this is able to help somebody. Thank you so much for watching.